Good morning. On behalf of the University of Wisconsin-Madison's Global Health Institute, I'd like to welcome you to our final event of a four-part webinar series, COVID and Equity, What We've Learned, Where We Go From Here. My name is Jonathan Patz. I'm the director of the Global Health Institute. For those of you who are new to GHI, we're a unit at the University of Wisconsin-Madison dedicated to improving and inspiring collaboration across campus and across the world, educating tomorrow's leaders and promoting research and outreach to improve well-being for all. GHI works at the intersection of health, equity, and sustainability. Our work is grounded in a global health ethic that recognizes the health of humans, animals, and the planet's ecosystems are inextricably linked. We work locally and globally, and our team has been involved in the COVID response, from frontline care to advising on policy decisions. We developed this COVID and Equity webinar series in response to the significant health disparities illuminated by the pandemic. Challenges of equity and systematic racism have been further magnified, of course, from protests over the death of George Floyd and others from police brutality, including this week's officer-involved shooting of Jacob Blake in Kenosha. GHI has brought together a diverse group of campus, community, and international voices to examine the lessons we've learned from the pandemic and to translate lessons learned into actionable next steps to move forward. Today, we welcome four incredible voices from Wisconsin who will help us think more deeply about racism, sustainability, equity, and health. Now, before we get started, I'd like to remind everyone that this session is being recorded. If you have a question for the panelists, please type them into the chat box by clicking on the chat bubble located at the bottom of your screen. To link to an archived video along with an event summary, they are available on our website. You can find these videos, this video and also previous sessions at ghi.wisc.edu. And I'd like to especially thank everyone who's helped organize this event, from our moderator, panelists, and GHI and DoIT staff. Now, without further ado, I'd like to introduce our moderator and good friend, Dekila Chungyalpa, director of the Loka Initiative at UW-Madison's Center for Healthy Minds. The initiative supports faith-led environmental and climate action efforts. Tequila was awarded the prestigious McCluskey Fellowship at the Yale School of Forestry and Environmental Studies, where she researched, lectured, and led fieldwork with students. She founded and ran the World Wildlife Fund's Sacred Earth program, as well as serving as U.S. Director for the Greater Mekong program. And she's also worked in the Eastern Himalayas. Tequila also serves as the environmental advisor for His Holiness, the 17th Karmapa, head of the Karma Kagyu School of Tibetan Buddhism. So it is with great pleasure that I welcome our moderator, Dekila Chungyalpa. Dekila, over to you.
Thank you so much, Jonathan. I am so grateful to you and to Lori DePrett-Brown for your leadership, and to the Global Health Institute for creating these dialogues that connect COVID and public health with racial and social justice. I also want to take a moment to say thank you to all the viewers who've joined us. It is wonderful to be able to participate in this panel with three incredibly powerful women who will be speaking next. 8 months into 2020, and you know we are living in the age of reckoning. Whether it is COVID, climate disasters, or the murder of African-American men and women in the hands of the police, we are collectively in a state of turmoil and mourning. Our world, our country, has become increasingly polarized so that simply wearing a mask or saying something as basic as Black Lives Matter unleashes violent rhetoric and action from the far right. We are siloed into camps: pro-science, anti-science, individual liberty, social good, universal human rights, white supremacy. 8 months into 2020, and almost 180,000 Americans have died so far from a pandemic that could have been managed, could have been flattened, could have been better controlled with stricter lockdowns. 8 months into 2020, and we not only have wildfire and tornadoes in California, we have wildfire tornadoes. We not only have extremely dangerous tropical storms hitting the Gulf, we have overlapping extremely dangerous tropical storms. And as of yesterday, an unsurvivable hurricane that's right now unleashed on Texas and Louisiana. 8 months into 2020, and we've learned that the two most lethal pre-existing conditions for COVID-19 are racism and economic inequality. When compared to white people, African Americans and Native Americans are 3 times more likely to get COVID and 3 to 4 times more likely to die from it. Currently, the Navajo Nation has the highest infection rate in the country, greater than that of the worst hit state, New York, also greater than that of Wuhan at the height of the outbreak in China. We are in a state of flux, where the possibility of social change has never been so near, where the support for social justice has never been so widespread, and yet, many of us are sitting right now with the weight and grief of what has happened in Kenosha. It bears repeating that what happened to Jacob Blake is not an anomaly. What happened to George Floyd, to Breonna Taylor, to Rodney King are not anomalies. That is the status quo. The facts are this. Over the past decade, 28% of those killed by the police are Black people who make up less than 13% of the population. In 2020 alone, the police have killed 751 people. In the last 7 years, 99% of killings by the police officers did not result in them being charged with a crime. And yet, 2020 is also the year of the largest movement in American history. People in all 50 states in over 600 cities have responded in outrage after the murder of George Floyd and are on the streets demanding police reform and defunding. The Black Lives Matter uprising is now a global movement and active in over 60 countries right now. We cannot talk about the health crisis we have today without talking about the historical and systemic racism that have been ignored up to this point. The U.S. has a history of disparities in education, income, wealth, housing, and these factors, these social determinants of health, disproportionately affect people of color, especially African Americans and Native Americans. High blood pressure, heart disease, diabetes, these are all underlying risk factors for COVID-19. They increase the risk of illness and mortality and are disproportionately borne by African Americans and Native Americans, and in particular by women in these communities, who are often the caregivers in their household and community, who already battle all kinds of biases, whether at the doctors, whether in housing or in employment. Racial justice, health, and the environment are also deeply interconnected. Native Americans are more likely to suffer from pre-existing conditions like cancer, heart disease, diabetes, because they were historically made dependent on government rations like flour, lard, and sugar, and because of the disproportionate number of hazardous waste facilities in their lands. 68% of African Americans live within 30 miles of a coal-fired power plant. Bearing the burden of air pollution is yet another reason why Black folks have higher rates of lung and heart disease. Exposure to air pollution is also why African American mothers face pregnancy and birth-related problems at a much higher rate than white people. So if we want to talk about creating an equitable future, we must understand our past, the systemic structures of oppression, and build restorative justice into our institutions, into our policies, into our academic programs. We need to find the best opportunities for greater racial and social equity in environmental, economic, and health policies. We have to fund programs that meet human needs, promote healthy and strong communities, and reduce structural inequities. And we must be bold in changing what leadership looks like and who is present in the room when decisions are being made. A recent study from the University of Liverpool examined global data looking at national COVID response plans and concluded that the countries run by women suffered half as many deaths from COVID-19 as their neighboring nations governed by men. In analyzing the reasons why, they concluded that these women leaders take less risk when dealing with human lives and more risk when dealing with the economy, whereas male leaders do the opposite. It's precisely because women have an interpersonal, empathetic, and participatory approach they are better leaders during a pandemic. They take non-military threats seriously. They believe sacrifice is necessary when it protects others, and they weigh individual liberty as less important when the greater good can prevail. This seems like a great segue into the three phenomenal women leaders who personally understand what sacrifice means, who are dedicated to the greater good of their communities, and who lead by building and listening to everyone around them. So with no further ado, I'd like to introduce the three speakers first and then turn it over to them. Dr. Jeanette Kowalik is the Health Commissioner for the City of Milwaukee. She has more than a decade of progressive public health experience, beginning with the City of Milwaukee's Health Department. She earned her doctorate in health sciences at UW-Milwaukee. She has worked for the Wauwatosa Health Department, Boys and Girls Clubs of Greater Milwaukee, and the Chicago Department of Health. She served as the UW-Madison Director of Prevention and Campus Health Initiatives prior to her transition to the Association of Maternal and Child Health Programs in Washington, D.C. She returned to Milwaukee in 2018 to serve as the Commissioner of Health. Janice Rice is a Ho-Chunk Nation tribal member and senior academic librarian emerita at UW-Madison. She serves as a clan mother for the Ho-Chunk Nation and is a board member of the Ho-Chunk Museum and Cultural Center and Little Eagle Arts Foundation. During her career, she has published articles in library publications, served on state and national boards, councils, committees that promote education, history, librarianship, civil rights, intellectual freedom, and cultural preservation. She received the Women of Color in Education Award from UW-Madison and the UW System and the Distinguished Service Award from the American Indian Library Association. Shelia Stubbs is a Wisconsin State Representative from District 77, the first African American to represent Dane County in state legislature. She serves on several committees, including criminal justice and public safety and state affairs. She is also secretary of the legislature's Black Caucus. She has served on the Dane County Board for 12 years, where she has chaired the Health and Human Needs Committee and co-chaired the Racial Disparities Subcommittee. She has led efforts to implement a restorative justice court program in Dane County, created a Dane County equity plan, and provided funding for a Dane County expungement clinic. She is also an ordained pastor. So I'm thrilled to have these three wonderful, phenomenal women leaders with us. And we are going to start with Dr. Jeanette Kowalik. I'm going to mute my mic and turn it over.
Thank you. Good morning, everyone. So, as noted, we're in a very emotional time of our history being here in this world, in this part of life. And I just want to acknowledge what's happening right now and just have a moment just to pause and just think of all of our ancestors, those that are still fighting the battles now, quietly in the streets, funding movements, voting, helping to get people into positions that will lead with equity, lead with love. So if we just take 30 seconds just to have a moment, just to breathe and just acknowledge everything that's happening. So it's very, very important for us to just have a moment to be still and reflect, because it's meant for us to be at this point in time in this world and everything. We're going through a pandemic right now, which is very, very scary, emotional. Many people have been impacted, lives have been lost. And I just want to acknowledge that in addition to dealing with our racial justice battles right now, and just had the interplay between COVID and what's happening right now. It's no mistake why all of this is occurring. So just acknowledging my role as a health commissioner in my hometown, which is the city of Milwaukee, and really growing up in a very divided way. Milwaukee has always been one of the most segregated cities or communities in this country, and that has shaped how I lead in public health, just really advocating for communities of color, for my community, the Black community, making sure that there's diversity, and not just diversity in show and face, but also in how we are able to make decisions. And it's been very, very tough, I'm not going to lie. But I honestly believe that we have been able to make some gains in the city of Milwaukee. So Milwaukee declared racism as a public health crisis last year. So the county, through the Office of African American Affairs, took the initiative last May, and then the city of Milwaukee followed suit in July of last year. So we're at the 1 year mark, over the 1 year mark for that declaration. The reason why this is important is because you have to acknowledge the problem first, right? You have to say that there's something that's wrong and it needs to be fixed. So the declaration includes a number of action items, which would be led by our Equal Rights Commission in the city of Milwaukee. And essentially with public health, you start out with a needs assessment, and then you move into various levels of action. So policy change, for instance. So this helped us with our COVID response. So as we were preparing for COVID, waiting for direction from the national level, the state level, and then coordinating with other local jurisdictions, we felt that it was very important to make sure that we were honoring our declaration and our COVID response. So early on, there was a public-facing map that was created by the county because we had this unified emergency operations structure. And with that map, it had a layer for race and ethnicity. So you could see that where our early hotspots or outbreaks occurred were in communities of color. So our African American community, Sherman Park, which is where I grew up. And seeing that was very troubling because you're watching it and you're like, you're trying to do something to stop it. So it's important to note that being able to see where things are happening, who's being impacted, not just looking at it from a cookie cutter approach, was really important for us to be able to change our strategy, our messaging, our outreach, access to testing, access to resources. So there's a number of adjustments that were made due to that knowledge, knowing that our communities of color, our African American community, our Black community, and then eventually our Latinx community were being impacted the hardest. So right now, about 35% of our cases are Latinx and about 33% are Black. And we have about almost 18,000 cases in the city of Milwaukee. So I just wanted to note, though, normally when you see hotspots or outbreaks for epidemiology, which is a discipline in public health, you tend to think of an event. So maybe people went to a funeral, went to a wedding, went to a party, and they were all exposed. But that wasn't necessarily the case. What we were seeing play out through our COVID response was racism. So the impact of racism on a variety of things. People's ability to shelter in place or stay at home, who's essential workers, who's still being exposed or at risk for exposure due to the types of work that is made available to them based off of their race. Also, we were looking at social determinants of health, housing quality, access to healthy foods, information, you name it. So all of these things were playing out. We were seeing this impact, who was being impacted the most for COVID-19. And as we started to share this in the media, other jurisdictions started sharing their information. So we started seeing similar trends in other cities across the country that COVID-19 was hitting people of color the hardest. So it was really important for us to have these communications, be open and honest about what was happening, and then really seeking some better ways to kind of reduce the impact of COVID-19. We knew that with racism being the root cause of the disparity, that it wasn't going to be something or isn't something that we can fix overnight. This is an issue that's really, really deeply rooted in our country. It's part of the fiber of our country, so we need to rebuild. So when we talk about what are we doing to fix this, obviously there's still a lot of politics involved with COVID-19 response, whether it was wearing masks, testing, who gets tested, various treatments, all kinds of things that have made us kind of look at public health officials and people in leadership positions with a side eye, like, well, what are you saying? Last week you said one thing, and this week you're saying something different. We also acknowledge that there's a lot of mistrust in government due to the injustices that government has played out in communities of color since the beginning of our country, even before the beginning of our country. So using other messengers and enabling them to lead community-based organizations, other leaders in the community, so that we were able to make an impact and get the message out there about protections for COVID-19 or from COVID-19. So I just want to acknowledge all of the efforts that have been made to date and that will continue beyond that. We're really interested in building communities up to lead, not necessarily having a savior complex like we normally do, but who needs resources, who needs to learn various skills so that they can take the ball and move beyond. That's what needs to happen at this point. And then lastly, just talking about other calls to action. So voting obviously is very important, making sure people are in positions that are going to lead with love and lead with equity and not uphold white supremacy. So it's important for you to really do your homework on candidates. What do they stand for? Even looking at their social media, what are they liking? What are they sharing? Who are these people? Really kind of looking at what are they about. And then we also need to prepare people to move into office. So not everybody's going to be a politician, but we need to prepare and groom people to move into positions that are going to lead with equity and love. So again, just acknowledging where we're at right now. It's a very emotional time, and I just want to just thank you for the opportunity to share what we've been doing in the city of Milwaukee.
Thank you so much, Jeanette. It really struck me when you said that, we think about COVID-19 impacts in terms of social demographics, and what's really played out is what's been lying underneath, around racism. And we can get back to it, I think, in the questions, definitely. I would like to introduce the next speaker we have is Janice. She is incredibly important to the Ho-Chunk Nation as a clan mother and holds the community together and has spent her life in service for her community. Hello, Janice.
Good morning.
Good morning.
Good morning, everyone. I'm pleased to be here with you as I share just one Indigenous perspective regarding healthcare and the COVID-19 realities. I'd like to begin by providing some background on Indian Nations of Wisconsin. Next. Nationally, there are 574 federally recognized tribes across the country. In Wisconsin, we have 11. Each of them have a responsibility for land, resources, economy, health, and well-being of our enrolled tribal members. Many of our people live off the reservations in nearby small towns and large urban areas. We have a unique nation-to-nation relationship with the federal government. From 1776 to 1871, the U.S. government negotiated treaties with Indian nations. These negotiations enabled some tribes to retain their hunting, fishing, and gathering rights. while also ceding vast amounts of land. The remaining tribally controlled lands became our Indian reservations. According to the Minority Health Profiles of 2008, our American Indian population in Wisconsin was 53,358. About 45% live in urban areas. In fact, the largest number is Milwaukee County at 7,313. Next. According to the Enrollment Office of Ho-Chunk Nation, our population was 5,505 as of February 2020. When we count those who live outside of the state and those in military service, the numbers rise to 7,863. Our Ho-Chunk lands of today are what remain of the 10.5 million acres of our homelands that ran from Green Bay to the Rock River area of Dixon, Illinois. Our Ho-Chunk lands of today are Indian allotments located in 16 counties of central Wisconsin. As Dekila said, our population is susceptible to diabetes, heart disease, asthma, and cancer. Combined with COVID-19, the threat to our middle-aged and elders is very high. As of Tuesday, August 25th, our Ho-Chunk Nation health records show that 1,772 people have been tested negative. 12 have been hospitalized, and right now we have 7 active cases. In April, we had 2 COVID-related deaths. And since June, we now have testing sites for employees and enrolled tribal members across the central Wisconsin. Next. In 1955, Indian Health Service was created. Their mission has been to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives. The headquarters is in Bemidji, Minnesota, and covers health services for Wisconsin, Michigan, Minnesota, Illinois, and Indiana. Eligibility is based upon tribal identity and income level. Urban Indians in Milwaukee began to receive health services after legislation was passed in 1976. Based upon the 2001 and 2005 Wisconsin Family Health Survey, American Indians were less likely to have health insurance. Next. Nationally, the 2012 U.S. Census update showed that 47% of American Indians had private health insurance coverage, 38% use Medicaid, and 22% have no insurance at all. And among our American Indian people, 26% live at the poverty level. Regarding COVID-19, Ho-Chunk Nation and other tribes in Wisconsin were among the first to declare a state of emergency and put our own safer at home orders in place. Because our leaders and health directors have a nationwide network, we were well aware of the pandemic. We joined the leaders from the West Coast tribes and Navajo Nation and began calling for social distancing measures in late February and early March. Next. We have used our connection to our land, clean water, and spiritual beliefs to guide us in our daily lives. As our grandparents told us, always take care of one another and make sure everyone is fed. All summer long, our health department used employees, tribal legislators, and volunteers to bring fresh vegetables to each of our Ho-Chunk rural communities and urban communities. With the recent loss of employment and stay-at-home orders, this program was really well received in our Ho-Chunk communities. Next. Our elders told us that all life is sacred. Each living being or creature is precious. The land that we walk upon is our mother, and we must treat her with love and respect. We all must work to preserve and protect the air, lands, and water for future generations. When we take positive action, we achieve better mental health and a sense of well-being and accomplishment. As the climate changes evolve, we seek the continual harvest of our crops, hunting and fishing, and the gathering of wild rice. We all need to protect our land, water, and resources. When we follow those teachings, our families will live in a well-balanced relationship with nature and attain a healthier life. Today, we as people of color are all in this global crisis together. Now more than ever, we need each other to join forces to alleviate the trauma and fear surrounding COVID-19. We all want the best for our communities. Let us work together. As the sun shines upon this new day, may we all dedicate ourselves to positive action. Next. Inequality. Thank you.
Thank you so much, Janice. That was incredible. It was so moving to hear you talk about the spiritual traditions and how the ancestors still guide us, and that we, as people of color, are in a global crisis together. I think it's a wonderful reminder. I know Jeanette also mentioned something about all of us needing to come together. So my third speaker, the third person I want to introduce, is someone who doesn't need any introduction in Dane County. She's our representative. She's someone who has addressed institutional racism throughout. I know she commissioned a study that looked at how people of color actually live very different lives in Dane County. Shelia, here you are. Okay, great.
Wonderful. Thank you, and hello to everyone. Thank you all for joining us here today. I want to thank Valerie Peterson for inviting me here, Global Health Institute. I also want to thank Milwaukee Commissioner of Health, Jeanette Kowalik, and Clan Mother of the Ho-Chunk Nation, Social Services, Janice M, for joining me here today. And a special thank you to Dekila for your moderating on today. My name is State Representative Shelia Stubbs, and I'm here with you today to talk about how we collectively can create a more equitable community. Next, please. First, we must define equity and how it is different than equality. Equality is centered on giving everyone the same resources, while equity is just and fair inclusion into a society in which all, including all racial and ethnic groups, can participate and prosper and reach their full potential. Equity gives all people a just and a fair shot in life, despite historic patterns of racial and economic exclusion. My source for that definition is policylink.org. Then we must determine what equity means in our community. This process empowers those who have been the victims of historically inequitable policies and have denied social, political, and economic opportunities. Their voices must be at the center of all conversations. They must be included in the room. And oftentimes, we need to change what the room looks like so we can have a more diverse community at the table. All voices must be included. Those of us who have been marginalized by all these institutions know firsthand how this system has failed. Next, please. We must be able to ensure that policies are sustainable. We need to create systems that perpetuate equity and can continually improve the lives of those around us. It is important that this conversation is pushed into action. It can't just sit dormant. We must do something with these conversations. As I have attended many protests, the word that they tell me over and over again is we need action right now. It is an urgency. It is an emergency. It is a crisis. So we need to be tangible and improving the advance of marginalized communities. Our role as leaders is to help create resources and advance strategies to benefit everyone, not some people, not a few people, but everyone in our community. We must use data to improve equitable and sustainable practices by building on what works and removing what does not. We can and we must create an environment for all. These steps are not easy. I can say firsthand, as a Dane County Board Supervisor, I've been working extremely difficult and extremely hard in all of the situations that's occurring to make sure that equity is a conversation that must occur in every level and every department throughout Dane County. Just last month, I introduced a resolution to call a public health crisis. Racism is a public health crisis, and we must be very clear in our message. It passed unanimously at the county board. In 2014, I introduced an equity resolution that passed unanimously, because what's happened in the past, we've been able to look at everybody else's world and systems, but we've not been very good stewards looking in our own backyard at the county and saying what we need to improve on. And we have seen in recent days, right here, right now, especially in the state of Wisconsin, the threats that the lives of Black and Brown Americans are constantly dealing with racism front and center. Our approach towards ending institutionalized racism needs to have the health and the well-being of Black and Brown people at the center of our conversations. That being said, let's acknowledge the problem, and that is the beginning of any conversation. You have to acknowledge that there is a problem. As we move forward, we must ensure that the process of creating, defining, and implementing these goals is equitable. That is why at the state level, I've been elected for a year and a half. That's why I introduced Assembly Bill 768. I introduced it last year in November, which would create an Office of Equity and Inclusion within the Department of Administration and fund it. This call to action was so great and so necessary that our very own Governor Tony Evers signed an executive order codifying this bill in Wisconsin to commit to equity and inclusion. Let me be very clear. In the state of Wisconsin, it is the absolute worst state to raise a Black family. That should not be okay with anyone. So instead of me allowing that to be the norm, I went to work trying to change every system that I could and reform it while I've been at the county level and at the state level. But in order to do that, we need to hold every agency accountable to every member of our community. We cannot let our state officials act without regard to the life of marginalized people. Next, please. We must also build on the strengths of all stakeholders and ensure that all voices are heard and respected. My colleagues and I in the Wisconsin Black Legislative Caucus know firsthand what parts of our system have failed us, what part of our systems have failed our families, and what part of our systems have failed our communities. As legislators, we are committed to action against institutional racism at all levels. One example of this is the upcoming legislative session that Governor Evers has enacted 9 bills that will help reform and correct our current policing system and being considered before the Wisconsin State Legislative on Monday, this upcoming Monday, August the 31st. LRB 6281, which creates a civil action if a police officer is unnecessarily summoned for racist reasons, which is a bill that's very personal to me. In 2018, when I was out knocking doors, I had an anonymous caller call the police on me. They thought I was a drug dealer. I've had a lot of national attention about that bill. So what did I say? We have to end racial profiling in the state of Wisconsin. So that is a bill that's near and dear to my heart. That is one of the 9 bills. LRB 6274, mandating use of force training for police officers. LRB 6273, mandating use of force policies to adhere to guidelines that protect life. LRB 6275, which grants $1 million to be dedicated towards funding community organizations that interrupt violence before it happens. We must get resources to our communities. LRB 6276, prohibiting chokeholds. LRB 6277, mandating use of force policies, public knowledge. LRB 6283, mandating use of force incidents be data collected and kept by the Department of Justice for public knowledge. LRB 6289, outline the no-knock warrant. And LRB 6292, creation of law enforcement standard boards. These are the very 9 critical bills that we need everyone to reach out to all of the legislators and senators across the state of Wisconsin and ask us to please come into a special session and get these common sense policies passed in the state of Wisconsin. This is what we need to see more of in our state. When people from marginalized communities are the driving force behind change, we can achieve great things. At the most basic level, we must make sure and work collaboratively with environments that are welcoming, non-hostile, but truly representation of the community. We must create an environment that centers communication, honesty, transparency, accountability for every team member, including all levels of leadership and power, systems for feedback and oversight that actively review complaints and concerns must also be implemented to ensure accountability and transparency. Going beyond this, and those with privilege must reflect on the way that their voices are heard and prioritized while working actively to listen to and elevate marginalized communities and our voices. We must understand that we all have to make a commitment. This is a call to action. We must all make a commitment to social justice. That means we carry the principles of social justice with us at all times throughout our personal and our public life. This also means a lifelong commitment to continuing with education. We work to improve our lives every day, nonstop. Commitment includes holding ourselves and others accountable for what's ongoing and what's a self-reflection of our department. Next, we must also build trust among communities, which will require time and effort. We need to restore trust and systems that govern us to move forward. That is why I advocated for the Community Restorative Court that focuses on 17 to 25-year-olds in Dane County that will eliminate a criminal record. I also took that same bill and introduced it here at our state capitol. I'm honored to say to you, it is a bipartisan piece of legislation. It is a critical piece of legislation that we must get passed. Next. So what can we do? It's a call to action. So what can we do and what do we need help with? At first, it is to support the voices of those a part of marginalized communities, empower their agency, promote the action. In addition, we must act to promote the well-being of our neighbors, advocate for policies that put the health and equity of people first. This includes promoting restorative justice courts. This includes looking forward to all of our policies. And we have to look at, and we must review racism as a public health crisis. We must move forward to end it. We must declare and pass these declarations. We must force private and public health institutions to learn more about and consider the effects of racism on patients of color, while we're considering their role in perpetuating racism in public health crisis. We must also talk about moving forward in equity. I must say firsthand, we need you to call your legislators. We need you to vote on November 3rd. We need you to complete your census. All of these steps are critical. Do it for your future. Do it for the children. Do it for your community. In addition with that, I would be remiss if I did not leave you with a specific quote of a former civil rights and activist from across the world, Nelson Mandela, bless his soul. And he said, "For to be free is not merely to cast off one's chains, but to live in a way that respects, that enhances the freedom of others." I have no doubt that we are up for change as we know the results are well worth it. And let's remember the fight of Black Lives Matter. Let's remember our brother Blake. Let's remember the Floyd family. Let's remember the Taylor family. There are so many names. Let's remember Tony Robinson right here in Madison. Remember their names. In fact, say their names. Thank you so much.
Thank you so much, Sheila. That was so powerful. I will be spending the rest of my day on the phone. So we are now going to move to the Q&A session, part of the session. And I think the first question that I want to start our conversation out with is all three of you have chosen your careers due to the desire to serve and protect your community, which means the work itself is really personal, it's emotionally charged and hard. And we are also right now, all of us are in crisis mode. We're dealing with the direct impacts and the loss of lives and so on. And it feels like there is a huge, reckoning that needs to happen with the mental toll and the emotional toll and just in terms of mental health in our communities. So my question to all three of you, and we can start with you, Sheila, is how do we take care of ourselves emotionally? How do we go the long run? How do we run long distance? And what are your recommendations so people can actually keep their inner resilience alive?
Great. Can you hear me? Perfect. Thank you for that particular question. It is so important that we have self-care. It is so important that we realize when we are at that state that we need someone to help us within our services. Sometimes, especially during this pandemic, I can say in Dane County, I know for sure that we've seen numbers increase with mental health services, the need to have the telehealth services. Because it's a pandemic, no one expected this to happen, but in reality, we are in a crisis mode. People are scared. And what we must do is make sure that we are given as many resources as possible. I'll be very clear with you, with myself, I'm a pastor, so making sure that I have my regular attendance with church. So I do a lot of services online. I also do a lot of prayer. So prayer helps me. Sometimes because people cannot get to certain facilities and exercise, but getting outside, walking, being a part of nature, journaling, cooking, finding whatever activity it is that helps you feel that you are having some place of normalcy. Because remember, it's the new normal. So many of us aren't doing what we used to do anymore. So we're picking up new ideas. I can share firsthand. I've heard of so many new entrepreneurs during the pandemic where people can go get their hair done or nails done, or they couldn't go shopping. They've learned to sew. They've learned to start up their own businesses. So this is a time that I said, when you've had a talent, you've learned to discover it, but most important, you have to have self-care.
Oh, you're good.
Jeanette? Jeanette, come on. Would you answer the question? Thank you.
Yes. I didn't know who was going. But I agree with Rep. Stubbs as far as the self-care. And I know that's cliche, but it's really important. And it's been very, very difficult for me to do in this job. For the most part, since we got our first COVID case, which was March 13th, Friday the 13th, I was working like 20-hour days for a long time. And eventually that started wearing on my health. I'm one of those people, a spoonie or whatever you want to call it. I have multiple autoimmune conditions. So sleep and eating at regular intervals and working out is really important for me. But I definitely neglected my health because I'm trying to look out for the health of my community. So, you know, like really recentering, having people in your life to remind you that you need to slow down, that you need to close the laptop, shut off the phone. It's also nice to have someone that you work with that understands that boundary. So my mayor, Tom Barrett, has been supportive. I've been working from home for the most part since March 18th. So having the ability to telework and having a robust telework policy has been really helpful. But it's been very hard to have good self-care in this job. I mean, it's a lot. We were already at a disadvantage since I started, you know, trying to rebuild the health department because we had a number of issues. So that from that to COVID, you know, and then we finally are receiving a number of federal funds, CARES Act money, to help us with hiring and getting an electronic health record and all of these other things that we've been lacking for so long. But there's a lot of stress tied to that because we don't know if that money will be rolled over to 2021. And we know that COVID is going to go on for a while. So it's not just going to end when New Year's Eve occurs. So, you know, thinking about the long haul, about what needs to be done to be able to survive. This is a life or death situation, literally. It's not just if you get COVID or not. It's also being in this environment and really helping to push through and lead with love, as I said, and equity. So, you know, I'm not the example of how to do self-care. I'm really the example of how not to do self-care.
I would like to say, however, you are the person that got us all to pause and slow down our breathing. That was incredible leadership right there.
Thank you. This is a little bit of time, right?
Janice, you might need to turn on your video.
I totally agree with everyone on what's been said. It's just been really exciting this morning to be a part of the panel. And I feel like I've gotten to know everybody better on a personal level, and that really is important. Because as we look at our situation, we are all in this together, and I feel like I've gotten more aware and more strength from what I've heard this morning. And as far as resilience and being able to continue to do what I need to do, the kinds of things that that work for me is to be able to meditate, to be able to be at peace. And I'm not necessarily leading with love, but I feel like what I'm doing is self-care. And I do a lot of walking out in nature and really appreciate what is around me. Because with COVID-19, we've all been isolated. I've been home since March 15th, and I've only been out several times. In fact, I've only filled the gas tank in my car 4 times since March 11th. So I try to stay as centered as possible. And one of the things that I recall early on is that when this happened to us in our country, in our community, it was just before Easter. And so some of our leaders in our community did a Zoom service on Good Friday, and we ended up spending time together that way. And eventually the community began to have our own spiritual ceremonies remotely, little by little, with families that are trusted because of the social distancing. So I feel like it's our philosophy and our feeling that many of us, you know, if you can't be together in a group to worship together, you can do it alone with the teaching and the tools that we've been given by our leaders. And so in many respects across Wisconsin and the nation, a lot of the tribes are doing their ceremonies in small numbers or privately in their own homes or in their backyards to stay spiritually connected, because it's easy to get distracted by what you see in social media about what's happening to our country. So that's basically what I have done, and my community continues to do. And sometimes it scares me because I feel like they're too close together, and are they going to be safe? So that's the dilemma as we use social media. I see that so many people are out there, and it's scary to me. So I continue to try to be at peace and do what I can do from here.
Okay. So because this topic is so important, I'm going to let us run over a little bit and ask you one more question. Sheila ended her presentation by talking about the 9 critical bills. And so with that energy, I'm going to ask Jeanette, if there is one action that our viewers can do, if there is one thing they can do when they get off this presentation, what would that be? What is the most useful thing they can do?
Well, I mentioned voting, and I truly mean that. Like voting, and not just the major election or the November election, voting in every election. As my grandma Dorothy used to say, she was really, really big on civil rights. Like I grew up reading a lot, being exposed to a lot. I knew what Juneteenth was as a little kid. But she was really adamant about reading and voting. Right? And if voting wasn't a big deal, then why are there so many barriers to doing? Why are there so many games that are being played with gerrymandering and redistricting? And I'm not trying to like open up the hours or access. It's like trying to limit things. And we saw that in April when we were really pleading with the state to either move the election date back or move to mail-in or absentee only. And we were told that we still had to do an in-person election during the pandemic. And that was like, things were really intense at that point in time. So, thankfully we were able to limit or reduce the end spread. But nonetheless, a lot of work, a lot of pain, a lot of passion went into that. So I just wanted to shout out my Milwaukee Health Department and Election Commission staff that helped to provide a safe election. But it was hard. It was a lot. So I'm just going to continue to beat the drum about voting and grooming people to move into office that are going to really represent the community and not switch it up and act brand new once they get into office. So thank you.
That's really important. Thank you. Janice, could you also answer that question?
I totally agree. Even in high school and middle school, I was always watching the elections and voting and all of that. So I think voting is very important. Legislation and our representation is really important. So even though we still do our tribal elections and work with our own tribal legislators, we start to collaborate in-state with people and nationally. So I feel like it's important that we all get out there and have our voices heard. And even though we are at home, there's a lot of ways to share our voices. And I feel like I just admire all the people that have the energy to carry those out. And I'm there, but I'm always sort of, I'm not in the forefront. My late husband was always at the microphone at these types of events. And my daughter and I would be there in support. And so I feel like a lot of the energy that our young men, Vietnam veterans, and our American Indian movement, a lot of our tribal leaders do that. They are able to get to the forefront and represent our voices. So I'm looking forward to being involved in more ways than the norm, the new normal, some way to continue to be involved.
Sheila, I'd love for you to have the last word. If there is one thing that our viewers can do after this session is over, what would that be?
Please vote. Please vote. That is so critical. And the other comments, I agree with every one of the comments that have been made. But the other part that I think is important is know your elected official. Have their phone numbers. Have it quickly. They should know you. You should know them and be able to have a dialogue and reach out to them because you are their bosses. My bosses are all my constituents. And if I don't do a good job in the next 2 years, they'll make a different decision. I'm so blessed that they've decided to bring me back. But we want to make sure they do that. And the final comment is, let's make sure you go out and complete your census.
Thank you so much. Thank you so much to all three of you. This was such a powerful panel. I feel like we've been just surrounded by elders or women that are on the verge of becoming elders. This is where we are as a community. And the messages that I heard that were really powerful was that we are working across all kinds of lines. We are thinking of us as a global community, as a national community, that we turn to each other in the sisterhood. We're holding it up. And the three of you are testament to that. So thank you so much. I also would like to say that for all three of us going forward, and for all of you that are watching, all four of us going forward, and all of you watching, that the best thing we can do as we move forward is stay calm, keep our energy to ourselves. And when we think about making the greatest change we can do, we have to think in terms of positive impact. And the greatest impact, because we cannot be everywhere all the time. And that's what all of our speakers are saying. So protect your energy. Self-care is really important, and vote. That's the most crucial thing. Thank you.
Thank you.
Thank you.
Awesome. Thank you.
Good night.